Active patients can be at risk of bone stress fractures, and these require specific knowledge of the specific sport, injury pattern, risk level, and healing profile. There are many different types of stress fracture with very different blood supply, and while mostly benign, they can lead to disastrous effects if not identified. An example of a worst case scenario because of the effects on blood supply is an undiagnosed superior femoral neck stress fracture, which can lead a young athlete to require a hip replacement if it ends up causing a femoral fracture. Whenever a fracture occurs with minimal trauma, it raises questions about bone health in general. So a comprehensive medical workup is needed, and that's really where a sport and exercise physician is specifically trained. While the treatment is generally some form of rest or immobilization, an assessment of markers of bone health and metabolic health, as well as contributors to the stress fracture, need to be considered for the best long-term management. Just as with any other injury, the process of recovery starts with optimal loading and a gradual upgrade in activities with both stimulus and substrate for tissue healing and remodeling. It requires regular review with a physio or allied health professional with summative medical reviews at key milestones to ensure that progress is being made. If there's a relative deficiency of energy after the body has used its energy on exercise and core functions, other bodily functions to do with reproduction, bone health, mental health and gut health can all be compromised. Although the loss of menstruation is a common feature of the energy deficiency triad that was once described, relative energy deficiency occurs in both men and women. Patients need to be educated about the importance of maintaining energy balance to support their energy requirements for their activities and exercise.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.